Hey, are you a passionate student nurse? You want to learn more, right? Then I'm here to give you a good news. Nurse Kelvin TV. Nurse Kelvin TV on YouTube is giving the opportunity to learn more about your field. And also, what I'll plead with you is just simple. Just subscribe to the channel, like, share, and comment so that we'll know your problem and also sort it out for you. Thank you for subscribing to this channel. Bye bye.
Hi guys, welcome up to Respiration TV. On this episode, I want us to talk about vital signs. I know it's a vital signs here at the choir friend vital signs, and we all want to learn a lot about it. That's the reason why this video is for you today. Guys, stick and stay with me and let's learn about these vital signs checking. In the next episode or in the next video, we are going to have a practical aspect of the vital signs checking, which we will be using some tools and how to check it to meet the NMC standard. My name is Nurse Kelvin. Let's get into it. So when we talk of the vital signs is the measure of the body's basic function or functioning of the vital organs that are very necessary for life. And this vital signs, is the body's it's very important to the body because it's going to help the body in response to physical, environmental, or psychological stresses. That's what's going to let you know. Then aside that one also, should in case there is a disease condition or there is a problem to the body, it's vital signs which is going to let you know about these things and all those. So guys, let's dive into it. So we have the things that we check during the vital signs. First one, we have the temperature. We have temperature. Then we also check the pulse or the heart rate. Then we have the blood pressure, which we call it BP. Then we also check the respiration. So respiration, which talks about the rise and fall of the chest, the rise and fall of the chest, the rise and fall of the chest. So that is what. But we also have additional vital signs that we don't normally talk about, but now it's very important in the hospital setting. So the first one, we have what the pain. Then we have the oxygen saturation. So should in case a patient is in pain, we need to assess the pain by using the pain scale to know the range, whether the pain is severe, the pain is what, the pain is moderate, or the pain is what, mild or other stuff. Yes, that's what we term as what the pain. So vital signs are assessed frequently. So it's assessed frequently and it's what is the duty of the nurse. The first one, you need to be able to check the vital signs and also be able to interpret it. So it's a job of you, the nurse, to be able to interpret the vital signs. Then you need to make sure you know the interpretation of the vital signs. Then aside that one also, you need to also based on the vital signs to plan the care. Such as plan a vital care assessment for the patient. So you need to base on what? On the vital signs to plan the care for the patient. Then aside that one, we need to know the normal ranges in vital signs. So we have the temperature, we need to know the normal range for temperature, we need to know the normal range for, and when we talk of ranges can change. So you insert any specific number, say this is the number, but we have range. So maybe within 120, and you need to also know the history and other therapies that may affect the vital signs. You see, you need to also know maybe it may affect the vital signs, but that can let the vital signs change. So the vital signs they change it from the normal range to different, you need to know all those sort of saying. Then like monitoring the vital signs is not just a normal routine care, but also a thoughtful scientific assessment which we do for a patient to help the patient to be able to gain or know like problems and they go through within that. Then let's continue. So we have the time that we need to check the vital signs. One is when the patient is on admission, or when the patient comes to, or the patient is being brought to the hospital, or comes to the hospital for a medical purpose, and I say for maybe a disease purpose. We need to check the vital signs. Then aside that, when the patient has changes in the health status, say I was that team yes, we need to also check the vital signs. That one too is very important. Then before and after a surgical procedure, you need to check the vital signs. So when you are sending the patient into maybe the surgical room or the surgery room, please, you need to check the vital signs. After that, you need to also check the vital signs because obi a surgery on man as a wako theater piano. You see, sir, before the patient will be taken into the theater, you can check the vital signs at the what? At the recovery center. Then Okoba I will say check it out is on being the normal range for the patient before the patient will be moved to the ward. So I want to make sure. Yes. Then we have uh according to physicians, so you need to also do it based on physicians' orders. So when I make sure, so when nipa no waba bi ano or blood pressure and also hypertension ya dia so nipa no a year you need to based on that you need to check maybe be 10 minutes be you need to check the vital signs for the patient. So yes, then when assessing the client during home visit, that one too you need to also check the vital signs. So now we've known about the vital signs. Nema checking the temperature and all those things. Let's talk about the tools that we use for vital signs. So checking the temperature, we have what? The thermometer. The thermometer now is what you use to check the temperature. This is called the stethoscope. Yeah? So we can use the stethoscope to check what? The heartbeat or the heart rate. So that's sometimes me feeling or hanum. So yeah, you can feel it here. Then aside that one, we also use the BP apparatus. We use the BP apparatus too. So we have the digital one. Then we also have this stigma manometer. We also use. Then during the oxygen saturation too, we use what the pulse oximeter. And then they checking what the oxygen saturation. Then the respiration. That one we are going to count what the rise and fall of the chest for 1 minute. Such as but that one you can do it by watching into the patient's face. Maybe the time that you are checking maybe the heart rate and as a checking the BP, you can go to me and share that on Saturday. I have to say we'll check here at the end. Then you are checking the patient what respiratory rate. I want to make sure. Yes. So guys, this is just the basis of vital signs. I will come again with a proper practical video of the vital signs, which we are going to do everything together. So during the vital signs, the things you need in America, your thermometer, stethoscope, you need your sphygmomanometer, then you guys for watching and keep on watching Kevin TV. I love you guys.